What is Captopril? Captopril, marketed under the brand name Capoten, is an angiotensin-converting enzyme (ACE) inhibitor prescribed primarily to treat high blood pressure, hypertension, and heart failure. Additionally, it plays a critical role in improving survival after a heart attack, especially in patients with heart failure, and in slowing the progression of kidney damage in individuals with diabetes. While its primary indications are cardiovascular and renal-related conditions, Captopril may be used for other purposes as determined by your healthcare provider. How does Captopril work? Captopril works by inhibiting the angiotensin-converting enzyme ACE, a critical component in the renin-angiotensin-aldosterone system, RAS. By blocking ACE, Captopril reduces the production of angiotensin II, a hormone that constricts blood vessels. This leads to relaxed blood vessels, lower blood pressure, and decreased strain on the heart and kidneys. What is Captopril, Capoten, used for? Managing high blood pressure, hypertension. Treating heart failure, typically in combination with other medications. Improving post-heart attack survival, especially in patients with compromised heart function. Delaying the progression of diabetic nephropathy, kidney disease caused by diabetes. Common side effects of Captopril. While Captopril is generally well tolerated, some side effects may occur. These often improve as the body adjusts to the medication but should be reported if persistent or bothersome. Skin rash, reported in up to 7% of users. Changes in taste, metallic or diminished taste, in up to 4%. Dry cough, persistent, in up to 2%. Mild itching, approximately 2%. Other potential side effects. Rapid or irregular heartbeat. Chest discomfort. Flushing or redness of the skin. Low blood pressure, especially after the first few doses. Signs of kidney impairment, such as reduced urination. Serious side effects, seek immediate medical attention. In rare but serious cases, Captopril may lead to the following reactions. Angioedema, sudden swelling of the face, lips, tongue, throat, arms or legs, difficulty breathing, abdominal pain, or nausea. Severely low blood pressure, dizziness, fainting, or pale skin. Kidney dysfunction, decreased urination, swelling of limbs, or rapid weight gain. Hyperkalemia, high potassium levels, muscle weakness, nausea, or irregular heart rhythm. Severe allergic reactions, swelling of the face or throat, breathing difficulties, and rash. Reminder: always follow your healthcare provider's directions and report any unusual symptoms or side effects. Do not stop or adjust your medication without professional guidance. Stay informed and protect your health. For more expert-backed videos on medications and health topics, subscribe to the HeInfo channel. Don't forget to like, comment, and share this video to help others understand Captopril, Capoten, its uses and side effects. Captopril dosage forms and cost. Captopril is available in tablet form, with multiple dosage strengths to suit a variety of treatment needs. These include 12.5 mg tablets, 25 mg tablets, 50 mg tablets, 100 mg tablets. Your prescriber will choose the dosage that best aligns with your condition, whether it's for high blood pressure, heart failure, or kidney protection in diabetes. Typical dosing for Captopril, Capoten. Captopril should be taken on an empty stomach, ideally at least 1 hour before meals to ensure optimal absorption and effectiveness. For high blood pressure, hypertension. Initial dose, 25 mg taken 2 or 3 times per day. Adjustment. Based on response, the dose may be increased to 50 mg 2 or 3 times per day after a few weeks. Maintenance dose typically ranges from 25 mg to 150 mg per day, divided into 2 or 3 doses, depending on other blood pressure medications being used. For heart failure, initial dose, between 6.25 mg to 25 mg, taken 3 times daily. Maintenance dose, usually ranges from 50 mg to 100 mg, taken 3 times per day. To improve survival after a heart attack. When to start, often initiated within 3 days after a heart attack. Initial dose, 6.25 mg as a single oral dose. Titration, followed by 12.5 milligrams 3 times per day, gradually increased over time. Maintenance dose, typically 50 milligrams 3 times per day, depending on individual response and tolerability. For diabetic nephropathy, kidney problems in diabetes. Typical dose, 25 milligrams 3 times per day, helping to slow the progression of kidney damage in patients with diabetes. Note, dosage adjustments may be necessary based on kidney function, age, and response to treatment. Always follow your healthcare provider's instructions closely and never adjust the dose on your own. How long does it take for Captopril to start working? Captopril can begin lowering your blood pressure within 60 to 90 minutes after a dose. However, it may take 1 to 2 weeks of consistent use to see a steady and lasting effect. For best results, monitor your blood pressure regularly as directed by your healthcare provider. Keep a record of your readings and share them during medical appointments. This helps your care team determine whether any adjustments to your dose are necessary. Why should you take Captopril on an empty stomach? Captopril should be taken at least 1 hour before meals. Food has been shown to decrease the absorption of Captopril in the body, potentially reducing its effectiveness in lowering blood pressure. Unless your prescriber specifically instructs otherwise, always take Captopril consistently on an empty stomach to ensure optimal therapeutic benefits. What foods interact with Captopril? General food interaction. Any food can reduce Captopril's absorption, so take it on an empty stomach. High potassium foods, e.g., bananas, oranges, leafy greens. These can increase your risk of hyperkalemia, a potentially serious side effect. High sodium or high fat foods. These can counteract the blood pressure lowering effect of Captopril. If you're unsure about how specific foods may interact with your medication, consult your healthcare provider or a pharmacist for personalized guidance. What medications can interfere with Captopril? Certain medications can reduce the effectiveness of Captopril or increase your risk of side effects. These include non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen. Certain antidepressants that can raise blood pressure. Always inform your healthcare provider of all medications and supplements you're taking before starting Captopril. You may be advised to monitor your blood pressure more frequently to ensure the medication is working as expected. Can Captopril cause hyperkalemia? Yes, Captopril may occasionally lead to hyperkalemia or elevated potassium levels in the blood. While rare, this condition can be life-threatening. You're at greater risk if you have kidney disease, have diabetes, take other medications that raise potassium levels. Your healthcare provider may order regular blood tests to monitor your potassium levels. If you experience symptoms such as nausea, muscle weakness, or irregular heartbeat, seek medical attention immediately. Is Captopril the same as lisinopril? Although both Captopril and lisinopril, Zestrol, are ACE inhibitors used to treat high blood pressure and heart failure, they are not the same. Dosing frequency. Captopril is usually taken 2 to 3 times daily, while lisinopril is typically taken once daily. Patient age. Captopril is generally prescribed for adults, whereas lisinopril is FDA approved for children as young as 6 years old with high blood pressure. If you're considering switching between these medications or have concerns about which is right for you, consult your healthcare provider for professional advice. Captopril is a powerful and effective medication when used properly. From treating high blood pressure to protecting kidney function in diabetic patients, its benefits are well established. But like all medications, it comes with responsibilities, such as timing your doses correctly, monitoring for side effects, and avoiding specific food and drug interactions. For more trusted health information backed by medical professionals, make sure to subscribe to the HeInfo channel. Like this video if you found it helpful, share it with someone who might benefit, and leave a comment if you have questions or personal experiences with Captopril. Stay informed. Stay healthy. Stay with HeInfo.